I want to introduce our first speaker. It's Dr. Sophia Vinogradov, and she is the department head and professor of the Department of Psychiatry and Behavioral Sciences here at the University of Minnesota.
Good morning, everyone. It's really nice to be here. It's nice to have a reason to come and do something a little bit more lively on this gloomy November morning. I guess I get to start by telling you a little bit about how I even come to be standing here. When I was a high school student, I never ever would have guessed that this is where I would be. And I can tell you that I made a number of what might be called mistakes along the way. If I had been sitting where you are today and I had said, you know, I really want to end up doing research at a medical school, a mentor might have said to me, well, don't do, do this, but don't do this, but don't do this. And all the things that they would have said don't do, I ended up doing. And yet here I am. So I'm living proof that there are many, many paths to the work and the career that you dream about and that will bring you the most joy and passion. So don't listen too much to the shoulds or the musts. Follow kind of where your instincts are taking you. So in high school, I was very much an introverted geek. I loved science. My favorite class was AP Calculus, and honestly, it was one of my favorite classes because when I was a high school student, there were not many girls being encouraged, to do AP Calc or AP Physics, and the AP Calc class, I was one of two girls in it, and we had a female teacher. So it was so cool to me that we had this, and she was like this feisty Southern woman, and so of course girls can do math, and so it was kind of a fun class to be in, and that was my favorite class. And my dream expedition, my dream job, and this had actually been my dream job since I was like 6 years old, was I wanted to go on a scientific expedition to some unexplored part of the world and discover something, preferably something having to do with nature or biology. Darwin was my hero. I kind of applied to Yale undergraduate, and I'm going to tell you about that in a minute because it was a bit of a catastrophe. That's first mistake number one if I had been listening to my mentors. My first job was in a law school library, good job for an introverted geek, wasn't very exciting, kind of boring. I read a lot. That's what I did. Now it's time to go to Yale, go to undergraduate. And I have all these, again, ideas. I'm going to take these interesting classes, and, so I'm going to really enjoy being there. It just wasn't a good fit for me. This is another, this is, again, an example of really if I was totally focused on pursuing my true academic career, stepping up the ladder, I would have gritted it out in some ways. But it was just not at that point in time a good fit for who I was. And I was miserable there. I hated it. So I left. And for several years, I was actually quite directionless. I was taking some courses at University of Michigan, where my family lived. I was taking some time off. I actually then ended up going on a trip to France, where I had found a job in a research lab there, sort of a part-time summer job through kind of a friend of a friend. And while I was there, I fell in love with a French graduate student, which of course was kind of much more interesting than the job in the lab. And I ended up living in France for several years. And, again, mistake number two, right? If you're going to pursue a career in research, hanging around in France, eating good cheese and, exploring Europe may not exactly be on that roadmap for success. But it was the most fantastic several years of my life. And while in France, I actually enrolled in medical school there. Because my significant other at the time, we were very young, was finishing up graduate school. And so I started medical school in a different system, in a different language, but it was, again, this incredibly rewarding experience. From there, I transferred back to the United States, where I got into a medical school in Detroit, Michigan. Detroit, the Wayne State Medical School is not known for being a research powerhouse. Again, if I was following that mentor-directed research, career roadmap, that would not have been, the best choice of a place to finish up my medical school work, but it's where I went. And again, I had an amazing experience being in an urban center like that, really learned a lot. And then from there, went into residency at Stanford, which was very research-focused, and then really started to get my research training. And that's how I come to be standing here in front of you today. What do I do right now? I'm the department head of the Department of Psychiatry. That means I do a lot of things. I take care of patients. In fact, you'll see me slipping out early today because today is my clinic day and I have patients to go and see. The patients that I work with are young people, usually between 18 and around 25, who are having their first episode of a serious mental illness, and I'm going to tell you a little bit more about that. And I do research trying to understand more about what's happening in the brain when someone gets that first episode of serious mental illness and what we can do about it. The other thing I do is I kind of lead teams of people. We have clinics, we do research, we teach, so all sorts of things are going on. No one day is like the other. It's totally interesting. And I'm still an introvert, so my extracurricular activities are the things I like to do in my spare time are the sorts of things an introvert likes to do. Hiking, gardening, yoga. So let me tell you about just a little bit, give you a taste of my research and tell you how I came to be interested in it. As I said, my research is really focused on how do we understand what happens in the brain when someone has a serious psychiatric illness, and then what can we do about it. And I really like to see my work as a balance between thinking about the neurophysiology, the biology of how the brain works, and the actual experience of a human being. This is why I still do clinical work. What is it like for the person who actually is having the mental illness? That's so important to really make the link between what can we discover as a scientist and how can we use that to help people feel better. And why did I become interested in this particular series of, or I would say group of psychiatric illnesses, which I will label as psychosis spectrum illness. So psychosis is when someone has lost touch with reality. And I use that term rather than the more common term schizophrenia, because we now know that schizophrenia is just a label. And it's not a very good label for a range of disorders. There's many, many different causes in the brain that can lead to this syndrome that has been labeled schizophrenia. So I prefer to call it psychosis spectrum illnesses. Illnesses which are characterized by someone having psychosis or losing touch with reality, and spectrum means that there's a whole range of them, and there's many different causes. So you may or may not be familiar. You may know someone who has a psychosis spectrum illness, or perhaps you've seen it on a television show or something, but let's just look at this video. This video doesn't have any sound. It's more just an illustration of what it is when someone has a very serious form of an illness with psychosis. So this is an actual documentary that was taken on the streets of San Francisco. This is a man in his 60s. His name is John Rutledge. And he lives on the streets. He believes that the pigeons are little tiny wizards who've been sent from beings from another planet to give him special messages. He refuses treatment. He lives by either food that the merchants on the streets give to him, or he gets things from the garbage cans. And he has been ill for many, many years. And this documentary was actually made by a friend who had known him when he was a young man. So what do we know now in 2021 about such an illness where someone has lost touch with reality, has delusions, very unusual beliefs, in his case about the pigeons and beings on other planets. He hears voices. Sometimes he's agitated and disorganized. He might stand on the street corner and be talking to himself and shouting. And it's kind of scary. And you might actually want to cross the other side of the street if you were there. So in 2021, one of the things we know is that the way the brain does all the things that the brain does, and by that I mean even all the things that are allowing you to be here paying attention to me, right? You're listening to me, you're comparing what I say to things you already know, you're perceiving the lights in the room, the images on the screen. All of this is because there's these complex networks of brain cells, we call them brain circuits or neural networks, which are processing information, all kinds of information, right? Perceptual information, information from your memory stores, sensory information, and the like, your emotional information, what kind of emotional state you're in right now. And so, again, this is just this illustration that you've got these billions of neurons that are forming these networks. Oh, this has an animation too, but it didn't come through. All right, never mind. It was not that great of an animation. But imagine this pretty animation where these networks of neurons and cells are firing with each other. So you've got these circuits that form, and different circuits are processing different kinds of information in different ways. And in fact, it's this brain circuit activity that is giving us our perceptions, our thoughts, our feelings, our actions, our motivations, our emotional reactions, and so on. Your brain circuits are activated right now. I could even make hazard a few guesses on which specific brain circuits are being activated. We have ways of imaging them. We have ways of correlating them with what you're experiencing and the like. That's part of the research techniques we have. And of course, what we know that is in psychiatry and psychiatric illnesses, brain circuit activity is abnormal. These circuits are not working properly. And this is an interesting point to keep in mind, because this is why psychiatry is different from neurology, or an aspect, I should say, of how psychiatry tends to be different from neurology. So when someone has a neurologic illness, like a stroke, right? There's been, for example, a bleed in their brain, and now they can no longer move their arm and their leg. We can find the lesion. We can take an image of the brain. We can see where that lesion is, and we can say, that's the cause of the inability to move the arm and the leg. In psychiatric illness, you can't do that. You can't take a picture of the brain and say, there's the problem. It's a circuit abnormality. It's the way the cells are connecting and talking to each other. Much harder to image and to probe. And just as an example, in mood disorders, we know that the brain circuits that are responsive to negative information in the environment are abnormally active. So when someone's depressed, they're below their level of awareness. They don't even know they're doing this. They're constantly scanning the environment for negative information and enhancing the representation of that information in their brain. And in psychosis spectrum illnesses, we know that the brain circuits are operating in a very disorganized and disconnected way, which is giving rise to the symptoms we see. There's one other thing that we know in 2021, which is psychiatric illness develops over time. John Rutledge was not always as ill as he is in this video. He was once a young man at the time when his diagnosis was made. He was a documentary filmmaker. He was quite successful until he began to develop these delusions that he was being followed, that he was being tracked by outside forces. He actually tried to set himself on fire because it was such a scary experience for him. And before that, he was a child in a family. He was that young child over there to the lower left-hand corner who had no signs or symptoms at all. And that's another area that I study, is what's this trajectory? How is it that someone with no outward signs of illness then starts to develop this full-blown illness? And one of the things we know is that we can intervene in a number of ways to improve brain circuit function, and that the earlier we do it, the better. So one of the things that we've found out is that some of the brain circuit changes that I've been describing to you, for example, in psychosis spectrum illness, is happening in adolescence, early adolescence, mid-adolescence, before the person has any symptoms. So my research focuses on, are there ways we can pick up some of that? Are there ways we can screen for it? And then are there interventions that we can give to individuals so that they don't develop the full-blown illness? The other thing that I do in my clinic, which, as I said, I'll be working with people later today, is people who've had that first episode of illness, like John Rutledge when he was a young man, when he had that first episode of feeling kind of hallucinations and delusions, that there are things we can do immediately at that point in time so that the person does not progress to this chronic, serious, persistent illness that has led to someone like John Rutledge ending up on the streets. So thank you for your attention. That's the work that I do, and I'm happy to answer any questions you have. Yes?
What are the methods that you say can cure or halt such progressions?
What are some of the things we can do? So there's a couple of things we can do. So right before the illness occurs, there are some, one of the things that we've learned is what triggers that first episode of psychosis. In John Rutledge's case, is that first thing where he started to hear the voices and wanted to set himself on fire, is usually a stressor. And some of you may know that when you experience stress, it causes chemical changes in your brain and your body. And those chemical changes in the brain seem to be the final tip. The stress-induced changes are the final tipping point that tips someone over. And so one of the things we do with people who are at high risk, who are beginning to show that they might be in that risk category, is we really teach them very, very rigorous stress reduction techniques. There's also some studies underway now of some potential, I don't want to use the term medication because they don't have full-blown symptoms, so it's not like we're medicating those symptoms, but different things you can do to improve brain health functioning at that point in time. And interestingly, one of them has been omega-3 fatty acids, and another has been CBD. So there's been a large-scale trial that's going on right now that there may be some anti-inflammatory and protective effects, because another thing that happens when the brain moves into that first step of psychosis is there's usually, in some forms of it anyway, some forms of neuroinflammation. So I would say, just without going into details, because there's still a lot of research to be done, looking for and addressing potential early phases of neuroinflammation has been one approach, and then stress modulation has been the other. Great question. Yes? Great question. So there's definitely genes that contribute to the risk for psychosis, and there's hundreds of them. And so it's not like it's one gene. The person has to have sort of a group of genes. But what we now know is it's a combination of having some of these combinations of genes and then adverse exposures in the environment. So bullying during childhood places someone at increased risk for psychosis. Trauma during childhood. Immigration status can actually affect it. Exposure to high-potency THC can push the brain over. Probably exposure to psychedelics as well. So it's this combination of genetic liability and environmental risk factors. I mentioned stress as well. It's interesting. I've had more than one occasion people consult with me where there's some, again, that label, schizophrenia in the family, and they're worried about having children. And I've pointed out to them that just because there are some genes, in the family, does not necessarily say that there's going to be schizophrenia. There has to be these environmental insults. Also, I think it's important to point out that with all psychiatric illnesses, with a great challenge can come great gifts. So there can be incredible creativity that exists in the person who has a psychosis spectrum illness, provided they don't have a severe form of the disorder, and there can be incredible creativity in their family members. So James Joyce, some of you may know him as a famous Irish author. There was schizophrenia in one of his family members, his daughter, for example, and yet he's one of the greatest writers of the 20th century. So, any other questions? No? Great. Thank you for your attention.